Hello everyone, Dr. Matt Ed. Today we'll talk about thoracic aortic aneurysms and its indications for repair. All symptomatic thoracic aortic aneurysm needs to be repaired. These include ruptured, dissection, and if it's causing pain. Repair of asymptomatic thoracic aortic aneurysm depends on the following: its diameter, its rate of expansion, family history of rupture, dissection, or presence of associated coronary heart disease or valve pathology requiring surgical intervention, and other conditions including connective tissue disorders, bicuspid aortic valve, familial thoracic aortic aneurysm dissection, Marfan syndrome, Loeys-Dietz syndrome, or Turner syndrome. Patients with asymptomatic ascending thoracic aortic aneurysm, a repair is indicated if the end diastolic aortic diameter is greater than 5.5 centimeters, or the aortic size index is greater than 2.75 centimeters per meter squared, or if the aortic area over height ratio is greater than 10 centimeters squared per meter. For patients with bicuspid valve aorta or trileaflet aortic valves, surgery can be considered in patients with greater than 5 cm aortic root / ascending aortic aneurysms if the surgery is performed at a comprehensive multidisciplinary aortic hospital. For patients with aneurysm of the aortic root or ascending aorta that are less than 5.5 centimeters, a repair is indicated if the expansion rate of greater than or equal to 0.3 centimeters per year in 2 consecutive years, or greater than or equal to 0.5 centimeter in 1 year. In patients with syndromic conditions, there is a lower threshold for repair. These include Marfan and Turner syndrome, Loeys-Dietz syndrome, and vascular Ehlers-Danlos. The threshold for repair depends on if the patient has risk factors or does not have risk factors. We'll talk about risk factors later. For patients with Marfan's and Turner syndrome, those without risk factors, repair is indicated if the thoracic aneurysm is greater than or equal to 5 centimeters, and those with risk factors, the diameter is greater than or equal to 4.5 centimeters. Patients with Loeys-Dietz, those without risk factors is greater than or equal to 4.5, and those with risk factors is greater than or equal to 4 centimeters. Patients with vascular Ehlers-Danlos, it is unclear when to intervene, and some have suggested for acute events only. Patients with non-syndromic conditions such as familial thoracic aortic aneurysm / dissection or bicuspid aortic valves, they also have less than usual thresholds for repair. So patients with familiar TAA / dissection, those without risk factors, repair is indicated with greater than or equal to 5 centimeters, and with risk factors is greater than or equal to 4.5 centimeters in diameter. Patients with bicuspid valve aorta, which we spoke about before, those without risk factors, repair is indicated in greater than or equal to 5.5 centimeters in diameter, but repair can be performed at an aortic center of excellence if the diameter is greater than or equal to 5 centimeters. And those with risk factors, it is indicated at greater than or equal to 5 centimeters in diameter. These are the risk factors that I mentioned previously, including family history of dissection, progressive aortic regurgitation, aortic expansion by 0.3 centimeters or more per year. For Loeys-Dietz syndrome, additional risk factors include female sex, and if they have TGFBR2 mutations. For patients with bicuspid aortic valve, additional risk factors include aortic coarctation and root phenotype orthopathy. For Turner syndrome, an additional risk factor is aortic coarctation. Marfan syndrome, its patient preference may inform a decision for aortic surgery before pregnancy when the aortic diameter is less than 4.5 centimeters. And for patients undergoing open heart surgery, including aortic valve surgery, replacement, or CABG, the repair can be done if the aortic diameter is greater than 4.5 centimeters. Patients with asymptomatic descending thoracic aortic aneurysm, surgery is indicated for patients with a diameter of greater than 5.5 centimeters. But if patients are a high surgical risk, then that goes up to greater than 6 to 7 centimeters in diameter. This is a summary slide of everything we discussed today. You can pause or save this for future reference. My reference is from UpToDate. If you thought this video was helpful, please like, subscribe, and look out for my next video. Thank you for watching.